Some of the major medical problems that are found in children with autism that I encountered as a gastroenterologist when I first came to this subject in 1995 was severe gastrointestinal pain, failure to thrive, so a child that would be falling off their growth charts, their centile charts, children with diarrhea, constipation or alternating constipation and diarrhea, children who had lost the ability to communicate their pain, and so they would involve themselves in repetitive behaviors that involve putting pressure on their abdomen to reduce that pain. And these symptoms were often interpreted by psychiatrists and psychologists as just the features of autism, just abnormal behaviors. They weren't. They were absolutely appropriate behaviors for a child who was in pain but could not communicate that pain. The other thing that we see frequently are immune disturbances, immunodeficiency, children who are suffering multiple ear infections, multiple upper respiratory tract infections, often necessitating antibiotics which do not appear to help. And then, of course, there are the iatrogenic medical problems that doctors introduce by putting them on psychotropic drugs to control their behaviors, which are, in my opinion, largely inappropriate and almost invariably untested for safety or efficacy in this population. The idea that autism was in any way reversible or treatable is relatively new. When I came to this, parents were told that this is a dead-end disease. Your child is going to be this way forever. Put them in an institution, forget about it, and move on. That is so far from the truth. And had autism been approached from a medical perspective, initially had these children's symptoms, particularly the gastrointestinal symptoms, been investigated appropriately, then there would have been a lot more that could have been done much earlier. So the kind of approaches that we would take would be to treat the bowel inflammation with anti-inflammatory medication, to put the children on a diet that excluded gluten and casein, so grains and wheat and casein, a product of cow's milk found in many dairy products. Complete 100% exclusion of those for a sustained period of at least 6 months to a year. Treatment with supplementation to give them back the nutrients that they were not absorbing through the diseased intestine. Probiotics, so restoring the integrity of the gut bacteria towards normal and maintaining that, because stopping those probiotics often led to a return of symptoms. Children often benefited from the introduction of antifungal drugs, suggesting that there was in some way overgrowth of yeast or fungi, or at least the byproducts of those toxic organisms causing symptoms in children. So the gut is the first point of treatment. If you can heal the gut, if you can correct the abnormalities in the gut, then you can make huge progress in restoring these children to health.